Hi everyone, it's my first time here too. I'm so excited and thankful. Today I'm going to talk about HIV care continuum, a bomb to inject drugs in Athens, linkage and retention rates, preliminary findings. These are acknowledgements and disclosures. And let's setting the scene. In 2011, Greece experienced a serious HIV outbreak among people who inject drugs, particularly in Athens. This outbreak represented one of the most substantial recent HIV epidemics in Europe and North America, signaling a critical public health challenge for the country. If you look at this graph, you'll see the number of new HIV diagnosed cases in Greece from 2009 to 2023. From 2014 to 2020, the incidence of HIV remained concerning, with 1.9 new infections per 100 person years. Alongside this, Greece faces a high burden of both HIV and hepatitis C infections. Despite efforts to control the epidemic, suboptimal linkages to care and poor retention in care have been significant barriers. So, the primary aim of our study is twofold. First, we seek to capture the 10-year HIV cascade of care among people who inject drugs in Athens. And secondly, we aim to highlight appropriate intervention strategies that can improve health services for people who inject drugs. This involves identifying gaps in care and proposing evidence-based solutions to enhance the quality and accessibility of HIV treatment support services for this vulnerable group. So, two programs were designed to prevent HIV epidemic, Aristotle and Aristotle HCV HIV, in two different time periods. These community-based programs in the center of Athens utilized a peer-driven chain referral method, also known as responder-driven sampling, to reach people who inject drugs. The primary aims of these programs was to increase testing and linkage to care for HCV and HIV. For these programs, we identified a total of 715 unique people who inject drugs living with HIV. Clinical data were meticulously collected from the medical records of these patients to ensure accuracy and reliability. To facilitate this process, we utilized a custom-designed recording form tailored specifically for the study's needs. As for the current state, we have successfully gathered data on this cascade of care for 45.5% of the identified patients, which corresponds to 3,025 out of 715 individuals. This data collection took place across 3 major hospitals in Athens, contributing valuable insights into the treatment and management of these populations. The 3 hospitals is Atiko, Laiko, and Evangelismos. The sample primarily consists of men, predominantly of Greek nationality, with an average age of 34 years. The majority of these individuals, approximately 80%, were diagnosed at the early stage A of HIV infection, while 12% have progressed to AIDS. One of the most striking findings is the extremely high rate of co-infection with hepatitis C, affecting 98% of the sample. Additionally, we observed a significant number of deaths, with 26.5% having passed away. In terms of substance use behavior, 47.8% reported intravenous drug use within the past month. Furthermore, 44.8% were not linked to opioid substitution programs. And then let's see the HIV care cascade. Despite early diagnosis through intervention programs and a high rate of linkage to healthcare facilities and immediate ART initiation, which is 87% in this population, the study reveals significant gaps in irritation in care, with 77%, treatment compliance plus undetectable viral load 72.5%, moving away from achieving long-term follow-up. Until now, we have the data. To sum up, I'd like to highlight the main points again. The cascade of care rates for people who inject drugs was below the desired targets, which the WHO has set. Our data were collected from a sample of this population who were mainly actively injecting and not linked to opioid agonist therapy. And a high proportion of HIV cases deceased, proving that HIV is a risk factor for higher risk of death in this population. Significant gaps in initiation to care among people who inject drugs in tertiary care settings can arise due to several key factors. As you see, these include stigma discrimination, which over-deter individuals for seeking regular care and mental health issues, which may complicate treatment adherence. Unstable living conditions and ongoing substance use or relapse further disrupt engagement with healthcare services. Financial barriers and fear of legal consequences also play a major role in preventing consistent access to care. All these highlight the need for targeted interventions to address these challenges. In Greece, we have a long way ahead of us. Thank you. This is the funding of these programs. The urgency of now, AIDS at the crossroads. Thank you for your attention.